Hi, I'm Keely Phillips, and I'm the manager of self-help and peer support. Self-help is a peer-driven service of CMHA, so everyone who works for self-help and everyone who volunteers at self-help identifies as having the lived experience of a mental health or addiction issue and brings that experience to the work that they do.
Well, we take a fellow traveler approach to mental health, so we're not counseling or therapy, but we're here to provide non-judgmental, open-minded support to folks who are looking for a friendly place to be to work on their recovery. We find the groups are a really wonderful place for people to know that they're not alone in what they're struggling with. Chances are there will be somebody at the table who has had a similar experience, and that can really go a long way in terms of feeling a sense of hope.
Self-help also has our Center for Excellence in Peer Support, which works to strengthen the presence of peer support and peer staff throughout the mental health and addiction system. So we work with non-peer agencies such as hospitals, addiction services, and community health centers to help them implement peer staff roles and peer support throughout their services.
In addition, we also have a creative wing, which we call Spark of Brilliance, which is recovery and self-discovery through the arts. And that offers a number of workshops every month, doing something creative as a way to support your recovery. One of the strengths of self-help is that we're ready when people are. There are no fees and no pre-registration to participate, so I'd say we're really accessible. We also have an advocacy coordinator who's on staff, and he walks beside folks who are being discriminated against based on mental health or addiction challenges. And there's also an entrepreneurship facilitator that helps people set up their own businesses.
From my own experience, knowing that I wasn't alone was extremely valuable to me in my recovery, and being able to walk beside and have other people walk beside me was useful in being able to find the strength and the hope and the skills that I needed for my own recovery, and we see that every day here.
And that's one of the most satisfying things of doing this work, is as someone with my own lived experience of mental health challenges, I get to see every day people grow stronger and stronger in their recovery and take on the similar work to what I do, facilitating groups.